Hi, my name is Dr. James Mirabile. I'm a board-certified obstetrician and gynecologist practicing in Overland Park, Kansas, which is a suburb of Kansas City. I've been in practice almost 24 years and presently just doing gynecology. When a patient presents to the office with abnormal uterine bleeding or menorrhagia, we'll do an ultrasound, we'll do an endometrial biopsy, and find the best possible treatment for that patient. If someone is in the childbearing years and still desires a child, then we have to be conservative, and I would recommend either birth control pills or an intrauterine device. However, if somebody is finished with childbearing, the Minerva uterine ablation device is an excellent alternative, or in my practice, a primary treatment for those patients. Basically, the Minerva endometrial ablation device is a very easy procedure and device all in one. The most valuable design features of the Minerva uterine ablation system revolve around the safety and efficacy. There's a two-stage uterine integrity test that allows us the safety of knowing that the uterus is not been perforated or the device has been misplaced. We also have the design of the cervical sealing balloon that creates protection for us. So there's three basic mechanisms within it. There's radiofrequency energy and argon to create plasma. There's thermoregulation and then intracavitary fluids. Previous devices used 180 watts of energy. We now use 40 watts of energy and an amenorrhea rate of 66%. Basically, the Minerva uterine device, the procedure itself is very simple for both patient and the physician. So Brandy, we're going to begin with doing a paracervical block where I inject some lidocaine at certain areas around the cervix in order to make it more comfortable when we go ahead and dilate you, okay? The entire time I'm working with the patient is usually around 4 minutes. And it begins with dilating and sounding the uterine cavity, which will tell me the length of the uterus. You might feel a little pressure with that. I'll then have my nurse open the sterile package and hook it up to the controller. Go ahead and plug the device in. Perfect. Now we'll walk through some safety steps here, and once it says the device is okay, perfect. And then I'm going to set the array from my findings when we went ahead and did the dilation and then sounding of the uterus. It gave me the length that I want to use. At that point, I have the nurse hold the button, which creates a vacuum on the tip of the device for easy insertion within the cavity. And you'll feel it going right into the uterus, just like that. You might feel a little pressure there. Okay, go ahead and release. Perfect. And then I'm going to seal the balloon, which will seal this within the cervix. And we are secure. There's a two-stage uterine integrity test that allows us the safety of knowing that the uterus is not been perforated or the device has been misplaced. Once we get a clearance and a green check mark, the foot pedal is hit and we count down from 120. And it's really nice with this controller that the patient can actually see the seconds go by. From 120 seconds down to nothing, and so if they are experiencing some discomfort, they know that, hey, this is going to be over in less than a minute, or 30 seconds is all I have left. The dilation and everything was okay?
Yeah, yeah, everything was great. I mean, there's a little pressure here, or there's a little pressure, you know, I mean, just...
It's a very minimal discomfort procedure. We're using a lot less power than we've had to use. The Minerva came out here, which I found to be the most ideal device. It just works. Patients are comfortable like this. Right now, you've already gone through a minute, and the device is at its maximum right now. And it'll just start going down in power, and you've been comfortable throughout the entire procedure.
Yeah.
So that's terrific.
Yeah, I mean, it's gotten a little stronger as we've been talking, or as we've been talking, but again, not anything, I mean, I would liken it to just bad menstrual cramp. I mean, and that's sustainable
Terrific.
for 2 minutes.
Right.
You know?
For most women that have been through pregnancy and childbirth and everything else, 2 minutes of a
Yeah.
little bit of uterine cramping is not bad.
Yes.
But that shows the device's ability to, provide, you're comfortable to be able to do the procedure without even having to go to sleep. With the birth of the Minerva uterine ablation device, we're seeing no downtime, we're seeing less bleeding, less discharge. So in my experience, I feel it is the ultimate uterine ablation device to be provided for patient comfort and patient success. You've had your ablation. What do you think? You like that?
Done.
All right. Terrific.